Hello, and welcome to the Body Fusion Therapy Podcast. I'm your host, Dr. Heather Demirci. In the posture series, we started talking about sleeping, then sitting, and this episode is going to be about standing. Now, there's a reason why I went in that order, because when we're talking about sleeping, it's more just about supporting the body. And you're not having to talk about really specific placement of things. It's more just about support. Then when we go to sitting, you're not concerned really about the whole body. You're just kind of working on the pelvis and a little bit of the arms. Standing is much harder because you have to think of all the components and how they go together. Standing posture is really hard to correct. It's something that's very habitual for people. And it's just one of those things that it's harder to try to fix than it is with sleeping or standing. So in today's episode, we're going to talk about why is it so hard to correct standing posture? What is efficient standing posture and how do you achieve it? So let's talk about why it's so hard. This is kind of a twofold thing. One is a physiological thing. One is more as a cultural thing. So physiologically, we have their equilibrium in our ears, our kind of vestibular system, the semicircular canals that have a lot of fluid in them. So this is kind of tells us that we're in an upright position, or if you were to tilt your head to the right, you're like, oh, my head's tilted to the right. Just kind of lets you know where you are in space. It's part of your proprioception. And especially when it comes to balance, it's a big one. You know, if you've ever had a really bad cold or ear infection, it's like you feel really dizzy. And maybe when you get up and you try to walk, you might fall over here and there. It's because of that effect of that semicircular canal and the fluid inside of it. So your nerves that are going in these canals, they're used to the fluid being at a certain level in a certain place when you're in standing and what your standing posture is. So if you change that standing posture, your body feels like it is way out of whack and it's not in the right position. So it's one of those things that it's hard to correct because you're going to feel like you're falling forward. Usually the most common thing that we're trying to fix is someone is too far back and we need to bring them up and forward in their posture. And it's literally going to feel like they are falling forward. It's going to feel so foreign. They're going to feel very unbalanced, but it's because their body is used to having this input of the fluid at a certain level within those semicircular canals. A great way to start to work on posture first when you're first learning it, because it's going to take a couple of weeks to kind of retrain your inner ear that this is where it's supposed to be, is to stand in front of the mirror, kind of sideways to the mirror, so you correct your posture and then look sideways and see that you are upright. There's a lot of people that I'll correct their posture and then they're like, I feel like I'm falling forward or I feel like I'm slouching. And I'll have them turn their head to look at themselves in the mirror and they see that no, actually they're stacked perfectly upright. And that starts to kind of retrain the brain because that visual cue is going to be much stronger than the cue they're getting from their inner ear. That inner ear telling them like, no, we're falling forward or we're really slouching. That's kind of lower on the barrel than visually being able to see where you're at. The visual input is stronger. So practicing this in front of a mirror at first is really beneficial to start to learn, no, I am in a good posture. I am upright. What my ears are telling me isn't exactly true. You just kind of have to recalibrate those settings of your inner ear. And as you start to get more and more used to being in that upright posture and you don't need that visual cue, you'll start to notice different changes in your body. You might notice how your core is engaged or how your feet are feeling, where you're feeling the weight into your body. And then that can be started the clue to help you so you don't have to stand in front of the mirror all the time and can start to kind of keeping that input going into your inner ear that, no, I'm in a good posture. You might think that I'm out of it, then I'm kind of falling forward or I'm slouching. But actually, because I feel where my weight is in my feet and I feel how my core is connected, I know that I'm actually in an upright posture. And it'll start to retrain the brain. But it takes some time. And that's why retraining how you stand can be really difficult because it's just going to feel so weird at first and so weird from an equilibrium standpoint. The second kind of factor that's affecting people's ability to change their posture is more of a cultural one. You know, I think we all grew up hearing the stand up straight, shoulders back. That's always what parents and adults tell you to get better posture is stand up straight, shoulders back. But really, that's not efficient posture. We'll go over that next, what efficient posture is. But that's the cue that we're always hearing. So it's really hard when I'm saying, no, you need to actually relax through your sternum, come forward a little bit. It doesn't seem right. And this is for men and women. As women, we are kind of trained to always hold ourselves upright, to be in that perfect posture. And especially if you have larger breast tissue, you're trying to hold up the weight of your breasts. And so, yeah, you kind of go shoulders back and lift up your chest and get a little bit of sway in your back. It's also viewed as kind of like a sexy pose to have, right? You kind of create those curves through your body. Like, I remember seeing the poster for the movie The Proposal with Sandra Bullock and Ryan Reynolds. Great movie, especially with Betty White. And if you see it, she's got such this crazy upright posture and this big sway in her back, and she's wearing these really tall heels, which heels are naturally going to put you into a bad posture. They're going to make you lift your shoulders up because it's almost like you're falling forward by having your heels lifted. So women have to undergo this kind of different change of settling into their system. Men do too, though. That kind of upright posture is very much like a military style posture, and it's not efficient. But it's a posture that a lot of men like to hold because they're trying to make themselves look bigger and stronger, and they think that shoulders back, chest up, everything puffed out is what's going to be showing this power, exuding their dominance. But it's not efficient. So it's kind of a hard habit to break because men and women are getting it on both sides. Now, if you were really tall when you were younger, you'll also see the tendency for you to become a little bit more slouched because everyone knows the worst thing in the world when you're young, especially like middle school, is to be different than the rest of your friends, right? You don't want to be different at all. And so if you grow taller before everybody else, a lot of times those kids are kind of slouching down, trying to make themselves shorter. And that's also going to be affecting how their posture is. And that's a hard habit to break, especially if you got made fun of for your height. You know, there's all those damaging things that we do to ourselves when we're younger as kids and what you say to other people. And it's really going to have an effect on how you stand as an adult. So it's hard to be able to change your posture. But when you're actually standing in efficient posture, you look much more relaxed. Because you are relaxed. You're not having to put yourself in this holding pattern of using those muscles that aren't meant to hold you in this position for so long to carry that whole weight of you. Those muscles are having to engage, and it's tiring. And so if you're in this relaxed position, it actually exudes a lot more confidence. And this is something that I try to tell my patients is that, you know, when you're standing in this inefficient way, which is leading to your pain elsewhere in your body, you don't look comfortable. So you don't look like somebody that's, you know, comfortable in their own skin and is exuding all this confidence. So actually being in proper posture, you're going to be showing that you're much more comfortable with yourself. And that's going to be much more attractive and also send much more of a message to people that, no, you have it going on and you're in a good place. So what is efficient posture? Well, if I was to define it, I would say it's the least amount of energy needed to maintain a stacked upright posture. Well, what do I mean by least amount of energy, right? Because if you're just standing, then isn't that just easy, right? Just to stand? But it's actually can take some effort to stand, and that's why people can get fatigued out with standing. When I was in Uganda, there were women that were walking with these huge piles of sticks or even, you know, jugs full of water, walking like 20 miles, and they had no problem whatsoever. And yet I have patients that complain that they can't stand longer than 20 minutes without getting fatigued out. So there is a lot of effort that it can take to stand. So when you're using the right muscles, it shouldn't be that hard to do it. So what do I mean when I'm talking about the right muscles? Well, I'm talking about those true core muscles. I talked about this, I can't remember what episode, it was one of the first episodes of the podcast where I talked about core. And so true core muscles have physiological reasons why they don't get lactic acid in them. So they don't fatigue out. They shouldn't fatigue out like your other muscles, like your glutes and your erector spinae and your quads and your hamstrings. Those muscles, they're made for strength but not endurance. And so they fatigue out. But your true core muscles should always be firing. But they only fire when they're in the right length tension relationship of that muscle. So the muscle can't be too stretched and it can't be on too much slack. It's just got to be in a sweet spot of this length for the core muscles to fire properly. And surprise, surprise, but if you're in a proper, efficient posture, then you will be stacked in a way that those core muscles can fire naturally and stay in a contracted state. So that is the least amount of energy that you are using to stay upright. So yes, there takes a lot of energy to stand if you're not standing properly. Because now, if you're standing in an inefficient posture, we're asking for those muscles that are made for strength but not endurance to do the job of holding you up and stabilizing your body and creating power. And they can't do both for a very long time. And that's why you fatigue out. So really, efficient posture is when you're not using those phasic muscles to keep in this like holding pattern. You really should feel effortless to stand. It should feel like nothing because all the weight is coming from your head all the way down to your feet from gravity. And it should feel like the weight is getting bared through your midfoot. So a lot of people will feel like if you ask them when they're standing, where do they feel like most of the pressure is in through their feet? They usually say their heels. It's too far back. It should really be more through the arch of your foot going towards the ball of your foot. That's where the forces should be going through. And then you're going to be in a much more efficient state. And like I said before, when you're trying to retrain the vestibular system, when you start to understand how your body feels when you're in a good alignment, when you can see yourself and be like, no, I'm stacked upright. I'm not leaning forward. I'm not falling forward. I'm not slouched. You start to also take stock of your body and how it feels and how the weight bearing is through your feet, or maybe how your breathing feels or how your abdomen feels. And from that, then you can start to be able to make those corrections when you're not in front of a mirror, so you can kind of keep retraining that vestibular system. So it's not just when you're in front of the mirror that you're training it, but just trying to feel through your body. And like I said, the definition of efficient posture would be the least amount of energy needed to maintain a stacked upright position. So how do we achieve this desired posture? Well, think of it as stacking blocks. So I want to make things as simple as possible. So we're just going to think right now about the thoracic block and the pelvic block. So if you were to hold 2 yoga blocks up, I think the best way to think about it is to take yoga blocks. You want it to be that if you have 2 yoga blocks, that they're perfectly stacked on top of each other, rather than one being tilted back or both of them being tilted in either direction. So let's think first about the pelvic block. So there's times like if you were to be in an anterior pelvic tilt, or more when you kind of have that sway in your back, that nice arch in your back, it would be like as if you're taking that bottom block and bending it, kind of tilting it forward in that position. That's going to create almost like a V opening in through the front. Now, if you're going to try to balance those blocks, which you can't really, but if you were trying to balance those blocks, the way you would counterbalance it is usually by then tilting the top block or your thoracic block backwards as well. And then it creates even more of an opening through the front in between the 2 blocks. It creates a bigger angle. They're not stacked on top of each other, but to try to balance it, you're going to have to be back. It could also be that thoracic block, that top block, is actually leaning forward a little bit. That's when someone kind of has like a depressed sternum, where they're a little bit more of a hunchback posturing. That can be a problem as well. And sometimes to counterbalance that, then the pelvis will kind of go into a posterior rotation as well. And then now you have a bigger angle through the back of the blocks, if you're thinking the front and the back of the blocks. So there's a lot of counterbalancing that can occur between the thoracic block and the pelvic block. And so we really need to be able to line up the body well, and so that you don't have to have these fighting moments, because you can't just let go of the blocks and hope that they're going to stay that way. The only way that you can let go of the blocks and for them to stay upright is if they're stacked perfectly on top of each other. And that's what you want to try to do with posture. So when we're thinking about how to achieve this efficient posture, I want you to think about how you're going to affect the pelvic block and then also the thoracic block. So think of the 2 blocks in terms of how we're going to find that efficient posturing. Now, if we're going to the first thing to do is really fix the pelvic block. This is what I find is usually the easiest, because there are times that there's really nothing wrong with the thoracic block, that it's just the pelvic block, but very rarely does the pelvic block not need to be fixed. The most common that we see is someone that's in too upright of a posture, right? The shoulders back, chest up. In that case, it's going to create more of that anterior pelvic tilt where that pelvis is tilted forward and creating that sway back. So the first thing you want to do if you're trying to correct your posture is you want to think about just kind of tucking your tailbone under. Or a lot of people, if they're in this position and their knees are in a hyperextended position or kind of locked out, you want to have a little bit of bend in your knees, just kind of relax through your tailbone. And you'll just kind of feel this lengthening in through your low back as you do this. So you just want to kind of relax through that tailbone, relax everything down, get a nice little bend in your knees. Pelvic block is usually pretty easy to fix. Like I said, it's more rare that it would be the opposite issue where it'd be a posterior pelvic tilt. You usually see that with your more elderly population that have that kind of arch back going on. Sometimes you'll see this with pubescent kids as they're growing and they're unsure of their height, like those kids that are trying to make themselves smaller, they'll have this as well. But you just want to try to think about having that block be straight up and down, not tilted one way or another. Now, the thoracic block can be a little bit harder to adjust. And it's because it's not as simple as just bending it forward. If you just kind of bend it forward, you're going to get almost a shearing motion that's going to be occurring through your vertebrae, through your back when you just kind of collapse it down. So you don't want to think about that. You actually either if the sternum is depressed, if that chest is kind of depressed too much, or if it's elevated, I would do the exact same way of correcting it. What I would do, and I do this with people, is I stand behind them and I'll hold onto the rib cage, on the lower rib cage with both hands, and I have them take a big deep breath in, and then I kind of hold their rib cage up. And patients, you can do this yourself. You could be standing in front of a mirror and take a big deep breath in and kind of hold up that lower rib cage. And then what you're going to do is you're going to imagine that you have a basketball in your abdomen. So that's why you kind of want to be thinking about going up and over. So it's not so much about kind of shearing forward. Like I said, it's not just kind of like pulling yourself forward. That's not how you're going to fix it. You want to think about going up and over this ball. Now, this is a lot easier to fix when someone's pregnant because they can literally feel the ball that's inside their abdomen. But what you're going to do is take that deep breath in, lift up your ribs, and then just kind of relax your belly and think about going up and over with your ribs. I will also have people look down towards their toes while they do this because that kind of helps bring them down and relax through their sternum, through their breastbone. So they first relax their pelvis, thinking about tucking their tailbone under, relaxing their knees, put their hands on either side of the ribs, take a big deep breath in, and then try to bring it up and over on top of the ball. So you just want to think about kind of bringing up and stacking that thoracic block on top of the nice neutral pelvic block that you just created. And then you just relax down into it. Now it's going to feel like you're slouching. And a lot of people, they just want to correct and lift their chest up a little bit more. But you just want to think about just taking a deep breath into your belly and just relaxing it all down. And you'll feel the weight increase into your feet. So this is something that's going to take a lot getting used to. I think this is the hardest part, is how to stack the thoracic block on top of the pelvic block. That is definitely the thing that people struggle with the most. They can usually understand the kind of relax their tailbone, relax their pelvic block, but the thoracic block is much more difficult to try to achieve. So once you kind of get used to that, going the up and over and settling down, you should feel like your core is more activated. You should feel more of that weight into the arches of your feet, going to the balls of your feet. You just kind of feel like everything settles down. It should be just easier to stand. You should feel a little bit more weighted down. You should feel heavier. It's kind of like how when you were sitting and I had you test and see, like if you lifted up your leg and you wanted to feel more weight into your feet, so you would sit further in front in the chair. It's because as gravity comes down on you, you want to feel that weight going down into the ground. You don't want to have to be holding up against gravity so much. And that's what happens when we're in those holding patterns, is you're kind of trying to fight gravity. No, we don't want to fight gravity. Gravity is always going to win, right? We learn that from Newtonian physics. Gravity is always going to win. It's always going to be there. It's a constant on our planet. So you want to get yourself in a nice neutral posture so then you're stacked properly and you're using the least amount of energy possible because those core muscles are firing because you're stacked efficiently on top of each other. So you want to feel that weight into your feet. You want to kind of feel that heaviness. You don't want to feel like you have to hold yourself away from it. So I actually want you to feel more weight into your feet. That is more efficient. So the biggest areas to fix are that pelvic block and the thoracic block. But then the thing that really bothers people once you fix that is like, but look at my head and look at my shoulders. And I agree. If you're used to being so upright through your chest and all of a sudden you settle it down, it's like your shoulders just kind of rolled forward and you're hunched and you probably have a little bit of a forward head posture. So there's 2 quick fixes to be able to do that. Like I said, those are minor in terms of making sure you're getting efficient posturing, but it seems to be the ones that affect patients the most, where they just don't like how their shoulders and their heads look. So to be able to fix the shoulders, what you would do is have your arms face or your palms facing back behind you. You just lightly shrug your shoulder up just a little bit. It's not crazy. You're not going like all the way up to your ear. You just shrug your shoulder up a little bit. Rotate your palm forward. Now, when I say rotate your palm forward, I don't mean lift your chest up. Nope, just rotate your palm forward and then relax your shoulder blade down. And if you look at yourself from the side, you will see that your shoulders just kind of go and sit properly on your rib cage now. So it doesn't take much. A lot of people, they just over exaggerate when I tell them to shrug up, they shrug up way too high. When they rotate their palms forward, they're just lifting their chest and they're going right into the inefficient posture. So it's really just a light shrug up, rotate, just think of just rotating your palms forward. That's all I want you to think about. And then lowering your shoulder back down again. And it's going to be much more settled on your rib cage efficiently. Then the easiest way to fix the head is just to slightly nod it down, just to let it relax down a little bit. And that's going to fix a lot of what's going on through your neck. Now, you might have other things that might be stuck. It might be hard to achieve. But those are more of the mechanical structural issues that you need a physical therapist to work on for you, to try to make it easier to achieve that posturing. But really, you should start to work on getting that efficient posture and then working with a therapist to try to make it easier to achieve that posture. But just because it's not easy at first, or it's not exactly how you want it to look, doesn't mean that you should stop trying. It's really important because your body's going to be functioning so much better and you're going to be using less energy. Your low back is going to be hurting a lot less if you're properly stacked. And you're able to take on a lot more if that occurs. That's why I said those women in Uganda, it was just amazing to see how much weight they could put on their head and walk as if it was nothing because they were perfectly stacked. Now, if you ask someone in a first world country to do that, they'd be falling all over the place. It wouldn't be balanced, and they definitely wouldn't be able to walk a football field length because it's just inefficiency with their posture. So when you're stacked beautifully on top of each other, it's just a lot easier. So like I said, first focus on the pelvic block, get the pelvis in a nice neutral position, then think about going up and over that basketball for the thoracic block. Like I said, it doesn't matter if it was because you had a depressed sternum or you had an elevated sternum. You just want to think about lifting up and over, relax down. To work the shoulders, shrug up, palms forward, relax down, and then just a gentle little nod of your head. I know it seems like it could be a lot, but if you just kind of do this repetition over and over and over again, practice in front of the mirror for a while until you start to feel in your body how it should be feeling when you're in a nice neutral posture, then you can start to make those corrections as you go through, but just be patient with it. It's going to take a little bit of time, but trust me, the reward is definitely worth it. So I hope you guys are standing up strong, but more efficient and more relaxed. Thank you for tuning in to this episode of the Body Fusion Therapy Podcast. Please share it with your friends and family, as well as leave a review if you liked what you heard today. We're looking forward to continuing this journey of looking at the body. Tune in next time.